These vaccines were developed in record time. Have they been tested enough? So we know that the COVID-19 vaccines were actually being able to be rolled out in populations within 6 to 9 months, which is unprecedented, given that it usually takes about 10 to 15 years for the normal vaccine development process. But it's really important to realise that none of the phases of vaccine development were actually skipped. The reason they were able to be developed so quickly is that some of the phases were overlapping, and there was also huge global investment in these vaccines, so that it was a lot more money and resources. A lot of the regulatory processes were overcome more quickly. There were certain platforms, like for the Pfizer vaccine, the mRNA vaccines, that were ready to go. So there are a number of reasons why these vaccines were able to be developed more quickly. But importantly, of those 3 phases, the phase 1, which is initial safety testing, phase 2, which is testing for the immune response to the vaccine or immunogenicity, and phase 3, which is really where we look at the clinical protection of the vaccine in the population, in sort of people of 30 to 40, in trials of 30 to 40,000 people. None of those phases were skipped. Does the AstraZeneca vaccine cause blood clots? So unfortunately, the AstraZeneca vaccine, as an adenovirus vector vaccine similar to the Johnson & Johnson vaccine, has been shown to be associated with this rare adverse event, TTS, or thrombosis with thrombocytopenia. And so this clotting syndrome is actually quite different to generalised clotting disorders, which is really important to understand. It's actually an immune-mediated syndrome that occurs, meaning that our bodies create antibodies to the platelets to make them sticky so that there's clotting, and then to destroy the platelets and cause bleeding. So this syndrome is very rare, and it is more common in younger people, so particularly under the age of 60, where the risk is estimated to be probably 31 people per million, or 3.1 per 100,000. And then for people over the age of 60, it's about 1.8 per 100,000, or 18 per million. So it's a rare adverse event. It occurs somewhere between 4 and 30 days after the AstraZeneca vaccine. It's more common after dose 1, not dose 2. But the good news is now that it is able to be diagnosed quickly, treated more quickly, and people are having really good outcomes. So the syndrome itself is really less severe. Thanks for your questions today, and I look forward to being able to answer some more questions soon.